Hi friends, I am Harsha. Today I am going to discuss on the final topic of this drug absorption and related physiological factors. In this video, I'll explain about the different methods to find out how we can track the drug transit and how can we find that where is it getting absorbed and what are the disease factors which affects the drug absorption. The common way to find the drug absorption and how is it moving into the intestine and what is the transit time. The best way to estimate is by gamma scintigraphy. It is a method in which we can track the drug when the patient is taken any capsule. This uh, a radio labeled non-absorbable radio labeled compound is also given with the capsule, and this one, when the patient is taken with this capsule, it goes into the intestine and we do not know exactly where it is getting released, but because of this radio labeled compound, it emits the gamma rays which can be detected from outside. So wherever it gets released, we can find out that location where it is getting released. We can also find the tracking. We can also study the gastrointestinal transit time. And wherever it is getting released, we can also simultaneously check the plasma drug concentrations. So it helps us in estimating the transit time of the drug, and also we can correlate with the plasma drug concentrations. Some of the pharmaceutical excipients like mannitol, it has a concentration dependent effect on drug absorption. Increased concentrations of this mannitol, it reduces the uptake of drug molecules from the intestine to the into the plasma circulation. But it has no change in the gastric emptying time, of course. The drug like codeine, it slows down the gastrointestinal transit time, and it also decreases the stool water content. We know that codeine has a side effect of decreased peristaltic movements of the intestine, and this may have decreased drug absorption, and also because of this reduced intestinal motility, there is more water absorption taking place from the colon, and some of the drugs may require water content to be easily absorbed through the colon. So when there is less stool water content, there is less drug absorption in the colonic region as well. Some of the drugs like lactulose, it increases the gastrointestinal time and it increases the stool water content. Some of the drugs may be benefited, like quinine is an anti-malarial drug. When it is given with lactulose, it has a very good absorption profile. Okay, what are these remote drug delivery capsules? Remote drug delivery capsules are some kind of capsules which can estimate the pH of the gastric fluids or intestinal fluids. This, how can we estimate this? Uh, we have a capsule, and with the capsule we can just take this capsule has a pH sensor. When it is present on when it is taken through the oral route, when it passes into the intestine through gastric acid and intestinal fluid, it has a pH sensor, and it also has a radio transmitter which can send the signals to the outside. So in this way we can actually find the pH of the solutions, which may help us in predicting the drug solubility and drug penetration to the blood. As this is developed by a scientist named Neuler in Heidelberg University, it is called as Heidelberg capsule. Some of the osmotic pump systems are also present, in which we can uh, there are some drugs in which the formulation in which the osmotic agents are present inside the formulation, which is covered with a semi-permeable membrane. The drug is also present inside the formulation. When it is taken inside, when it is taken through the, when it is taken by the patient, it passes into the intestinal fluid, and we know that intestinal fluid has some water, right? So this water gets penetrated into the semi-permeable membrane into the formulation because there is an osmotic agent inside. So water gets penetrated inside. So when water gets inside, this membrane, because the water, because it is getting more inside, so it starts bulging. When it starts bulging, it the drug which is present inside, it gets released. So in this way, this osmotic agent helps in the drug release from the formulation. And because it is not dependent on the plasma drug concentrations, it has it follows the zero order kinetics. It is only dependent on the water. When water is present, it releases, it takes in, it gets into the formulation product and it releases the drug. That's it. So how do we perform the gastrointestinal perfusion studies? Previously, generally people use it to do the experiments on guinea pig, ileum, and then try to estimate the gastrointestinal perfusions of the drugs. But um, it is very hard to correlate with the animal data to the human data. There are some good advanced methods to study the gastrointestinal perfusion studies, and jejunum is taken for these studies because there are some techniques in which the intubation systems are present, and we can put that through the we can put that through the mouth or through the anus and fix it at a particular location, like jejunum, which has very less peristaltic movements when compared to the duodenum and ileum. So so this location is very good for these gastrointestinal perfusion studies. And the drug is released at a fixed rate, and we can estimate that how much of a drug is getting perfused, and we can simultaneously check the plasma drug concentrations. And intestinal permeability to drugs is dependent on many factors like physicochemical properties of the drug, and sometimes the different genetic differences between the patients. Some people may have poor drug bioavailability because of different membrane protein concentrations and different metabolizing enzymes, and some people may have higher drug bioavailability. It depends on the concentrations of these drug transporters and the enzymes present in their body. Uh, the other way in which how we can find out whether the drug is having intestinal permeability or not, by using a simple in vitro system of oil by water partition coefficient. This predicts the drug permeability. So oil by water partition coefficient is nothing but the ratio of the drug penetration into the octanol by water. For example, you have some X drug which you don't know whether it is soluble in it is soluble in oil or water, and you take that drug along with the oil and water into this kind of shaking flask, and you mix all together and then keep it upright for a while, and then it starts separating between the oil and water because these two are immiscible liquids. So they start forming two layers, and if your drug is having an aqueous hydrophilic character, then it starts settling at the aqueous layer, and If your drug is having a lipophilic character, it would be present in the lipophilic layer. In this example, some green solution is present in the aqueous layer. In green solution is present at the bottom. And for example, if you have a next drug which is having more affinity to the aqueous layer, you can easily separate that one also from that. For example, you have 2 or 3 drugs, and one drug is highly lipophilic and one drug is hydrophilic, and you can separate them by using this method. The amount of the drug which is present in the lipophilic layer to the hydrophilic layer is called the oil by water partition coefficient. The more the oil by water partition coefficient, the more it has an intestinal permeability, because intestine is lipophilic. Is the drug it is highly lipophilic, so the drugs which are lipophilic can easily cross the intestinal barrier. Some other ways which we can actually test the drugs and see if our drugs can penetrate the intestinal barrier. Not every time we can use the animals or humans for the perfusion studies and the permeability studies. We can also use some simple in vitro cell lines like CACO2 cell lines, which is actually a human colon adenocarcinoma cell line, which is used for this drug permeability studies. It is a monolayer, and if you see in this picture, this is a confocal micrograph picture in which the cells are interconnected with tight junctions. The tight junctions can be seen with those blue colored marks. And inside the cell, the red nuclei we can see, and the other outside we can see that all green matter as a cytoskeleton. So it is a tight junctions, and we can study the drug permeations. And we can also study the interactions of the drugs with PGP, because it also has a PGP, P-glycoprotein. The drug transporters also play a major role in the drug absorption. The drug, when you take, it passes into the blood circulation through passive diffusion from the intestine, and it's fine. And intestine into the blood circulation into the cells of the target organ through passive diffusion, it's fine. But it again has some drug transporters. The cell has some drug transporters which is actively transporting the drug which is present inside. Some of these transporters like PGP, P-glycoprotein, is highly seen in the drug transporters, which plays a major role in the efflux of these natural products or some of these antineoplastic agents or some of the cytotoxic drugs from the cell into the outside. If you see in this diagram, the drug vincristine is passing into the cell membrane through passive diffusion, but it passes back into the extracellular surface through this P-glycoprotein. In this way, it actually helps in the reduction of the cell drug's toxicity, of course, in the patients. This PGP is present in the blood-brain barrier, liver, and kidney. They all help in the removal of the xenobiotics and some of the toxic chemicals from the inside of the cell to the outside. From the intestinal layer also, there are lots of drug transporters which help in the efflux of the toxic chemicals from the intestine to the out onto the from the blood plasma, from the blood to the intestinal lumen. It passes through all that toxic compounds outside. Some of the drugs like paclitaxel, they they induces the nuclear hormone receptors like steroid xenobiotic receptor. Paclitaxel is an anti-neoplastic agent, and we know these anti-neoplastic agents are substrates for these drug transporters. And these paclitaxel, the anti-neoplastic agents like paclitaxel, they get inside the cell, but it also gets excreted, but it also gets effluxed through PGP. In that way, the actual drug concentration is reduced inside the cell. Not only that, paclitaxel also induces this SXR, which actually increases the proliferation of these drug transporters. So there is a lot of more of these P-glycoproteins expressed, and there is more drug efflux from the cell. And not only that, it also activates the metabolizing enzymes like CYP3A4 and CYP2C8. These two metabolizing enzymes are very essential in the liver, and it helps in the metabolism of many compounds and food and drug products. So when this metabolism is activated, the parent drug molecule is the concentration of parent drug molecules is decreased, and thereby there is a decrease in the efficacy. Pharmacogenetics plays a very major role in the multi-drug resistance and in the therapeutic efficacy. For example, if we can see any person having, if patient is having good efficacy and other patient is having no efficacy, then the difference between these two people are not about the drug's quality. It's about the patient's genetic differences in these drug transporters. Whenever there is a therapeutic failure, we may have to ask ourselves, is that the therapeutic failure because of the genetic differences in the drug transporters? We may have to ask ourselves to these two questions. Is that the drug a substrate for these drug transporters like PGP? And the second question is that the drug is a substrate for these CYP3A4 or CYP2C8 metabolizing enzymes? If there is two are substrates for this, then the therapeutic efficacy is reduced. And some of the disease conditions also may affect the drug absorption. These are some of the points in which they affect drug absorption: changes in intestinal blood flow, gastrointestinal motility, stomach emptying time, gastric pH also affects the drug solubility, intestinal pH, gut wall permeability, bile secretion, digestive enzyme secretion, and alteration of the gastrointestinal flora. One of the examples is Parkinson's disease, in which the patients have a difficulty in swallowing the drugs, and they also have reduced gastrointestinal motility. So for these patients, people have also observed that the drug which we actually use for the Parkinson's disease, called levodopa, their drug absorption is also decreased in these Parkinson's patients. So what people generally the doctors, gastroenterologists started doing is that they went on to this method of jejunostomy, feeding tube, in which the drug is released from the outside, and this tube is attached to the jejunum of the intestine. So the drug it just carries like a bag to the outside. So in this way, the drug absorption can be increased, and then the therapeutic efficacy can also be increased. Tricyclic antidepressants and antipsychotics like phenothiazines, they have anticholinergic effects and they reduce the gastrointestinal motility and they reduce the drug absorption. And some of the echlorohydria patients, they have a decrease in the solubility. They have uh, reduced absorption of these basic drugs. Some of the weak basic drugs, they require some hydrochloric acid to get dissolved and then to be absorbed. But in the echlorohydria patients, they have reduced hydrochloric acid secretion, and there is no so it does not help in the absorption of and dissolution of these basic drugs. Some of the drugs like dapsone, itraconazole, ketoconazole are very less absorbed in chlorhydria patients. And even when the patients are undergoing with the proton pump inhibitor treatments, like omeprazole is given to the patients, they also reduce the gastric acid secretion and thereby it decreases the absorption of the basic drugs and all these dapsone, itraconazole drugs. And if the patients are taking some orange juice and some soft drinks with carbonated sodas, they they decrease the pH and thereby increase the gastric acid and they can facilitate the absorption of the drugs. HIV/AIDS patients also have a rapid gastric transit time and they suffer from diarrhea and it, these patients also have some erratic drug absorptions. Indinavir is a drug is used in the HIV/AIDS, and this Indinavir drug is uh, favorable, favorably soluble in the acidic environment, and its therapeutic window is also very narrow. Some optimal serum concentrations are critical. So any change in the acidic and acidity of the in, acidity can disturb the Indinavir's therapeutic efficacy. Congestive heart failure also reduces the splanchnic blood flow. It decreases when there is a reduced splanchnic blood flow. There is a decreased uh, drug absorption through the passive diffusion, and thereby the drug, thereby the efficacy of the drug is reduced. Furosemide, which is a diuretic used in the hypotension patients, their drug absorption is decreased because of this reduced splanchnic blood flow. Crohn's disease is a inflammatory disease. Sorry, it's a intestinal disease in which the thickness of the intestine gets increased and the anaerobic bacteria is also increased. In these patients, uh, they have very less absorption because of when there is an increased thickness of the intestine, there is little absorption taking place. But the propranolol drug concentrations are increased in the plasma because in these patients, the alpha-1 acid glycoprotein is increased in the plasma. And this alpha-1 acid glycoprotein is having affinity to the propranolol. So it binds to this glycoprotein and thereby increases the plasma drug concentrations. This is the protein binding. Celiac disease is another kind of disease in which there is inflammatory condition of the intestine. It's because of the sensitization of the intestine with uh, a substance called gluten, which is present in the cereals. In these people, the drug absorption is and the drug absorption is increased in the drugs like cephalexin, and they have increased rate of stomach emptying and permeability. Some of the drugs like anticholinergic drugs, tricyclic antidepressants, antipsychotics, they have reduced peristalsis and Thereby, it decreases the drug absorption. Other drug absorption. Some of the drugs like metoclopramide, when it is given to the patients, they have a very high peristalsis, increased peristalsis, and it has an effect on digoxin absorption. Digoxin requires an environment where there is a moderate peristaltic movements. But when metoclopramide is given, the increased peristalsis, increased peristalsis makes this digoxin to uh, spend less time in the intestinal region to get absorbed through the intestine and to the blood circulation, and thereby decreasing the peak drug concentrations of the digoxin. But this digoxin can be increased when digoxin concentrations can be increased when anticholinergic drugs like propanthenol bromide is given. So it depends on the intestinal contractions and peristalsis moments. Antacids also should not be given with the drugs like cimetidine, and antacids with aluminum or magnesium salts when they complex with the tetracyclines or ciprofloxacin or indonavir drugs, they have reduced drug absorption. So that is why when these patients are given with these drugs, they are advised to take antacid before the 2 hours before the drug is taken, or 6 hours after the drug is taken. Cholestyramine is another drug which is actually used in the treatment of hyperlipemia. It acts as an activated charcoal. It adsorbs to the warfarin, thyroxine, and loperamide, and thereby reducing the absorption of these drugs and decreases the efficacy. Vitamin D, we know that it helps in the absorption of calcium, and decreasing the calcium leads to the rickettsia. This vitamin D helps in the absorption of calcium from the intestine. It increases the calcium binding protein in the small intestine, from which the calcium containing foods, they get absorbed through this calcium binding protein into the bloodstream. Thereby, vitamin D helps in the drug absorption of calcium. Some of the nutrients affect the drug absorption, like vitamin B12, which is a water soluble vitamin. Uh, Absorption is required only when there is an absorption is required it's only possible when there is an intrinsic factor. Intrinsic factor is released from the stomach. This vitamin B12 is bound to this intrinsic factor in the stomach, and it travels through the intestine up to the small intestine into the where duodenum and ileum, where it actually gets absorbed. Here the vitamin B12 dissociates from the intrinsic factor and vitamin B12 gets absorbed. A very common example, grapefruit juice affects the drug absorption. Grapefruit juice contains a chemical constituent called naringin, which inhibits the CYP450 enzyme. Cytochrome P450 enzymes are very common enzymes which help in the metabolism of all kinds of drugs and nutrients. So inhibition of this CYP450 enzyme leads to the increase in the parent drug molecule in the plasma, and thereby it may increase the efficacy or it may also increase the toxicity. There are some other drug delivery methods like nasal and inhalation drug delivery. The nasal drug delivery, like aerosols or nebulizers, can be used as an alternate mode of therapy. And nasal passages have a very less surface area when compared to the gastrointestinal tract, but they are very richly supplied with the blood vessels. Uh, For a better drug delivery into the nasal regions, a drug should be lipophilic, so that it can easily pass through the nasal epithelium, and uh, surfactants should be present so that it can are required for easy transport of these drugs into the nasal epithelium. But these surfactants are some of the surfactants are very irritating, so that can be, again, it's a very challenging one to do this nasal drug delivery, and very little absorption can take place. Some may be swallowed, when it can also get exhaled through the nose itself. Inhalation drug delivery is also very common, like the salbutamol, which is used in the asthma patients. The lower respiratory tract is having a very large surface area, which is more than the surface area of the gastrointestinal tract, because of this alveolar bronchi, bronchioles, alveolar sacs. This has a very large surface area with high good blood supply, but the main thing is that the drug which you take, it should reach up to the bottom of the lower respiratory tract for a better absorption. Most of the drugs, the drug particle size, the droplet size also matters here. The larger droplet size may be inhaled, but it may get swallowed, or if it has a very less particle size, it may be inhaled, but it can be exhaled immediately. So it should have a moderate particle size. And most of these inhalation agents, even though when they are given through the inhalation, only 10% of it may have some absorption taking place. The other ways of delivery of these drugs is by using the topical methods, like ointments and creams, which we can be applied onto the skin, generally used in many other incidents. When we get wounds, we can apply onto the skin, which can have some local therapeutic effect. Sometimes it may show some systemic effects. The other methods, like transdermal drug delivery, which is very common nowadays, uh, mostly used in delivering the nicotine through this patch into the systemic circulation. It is used in reducing the addiction of these patients who are not patients, reducing the addiction of people who are smoking. So this transdermal patches can be stuck to the skin of anywhere, and it gradually releases the drug from the patch into the systemic circulation. So these are different methods of drug deliveries, and with this we end the drug absorption and related physiological factors chapter. Thank you for watching the video, and please do not forget to subscribe.